So this is a video about postpartum care for the mother and the baby. So this is the mother. We have to assess her. First, we begin with the breast. We palpate each breast for firmness, fullness, tenderness, and contour. So mom, do you have complaints of sore nipples? No? Okay. So let me check if the nipples are red. It's not cracked and it's not bleeding. Okay, which is a good thing. So I encourage you, mom, to wear a support bra whether you're nursing or not nursing. So for the uterus, we have to assess if it's firm or it's boggy, and we all know that the fundus should be firm. So if not, we have to gently massage to obtain firmness, and we have to note if there are any excess bleeding or clots expelled during the massage. So I'm gonna check the fundal height, mom, but before that, I will let you void first and I will lay you flat on your back. So if your patient had a C-section, you have to inspect for the dressing or incision at this time, and we have to note for any redness, discharge, and approximation of the incision if uncovered. And also don't forget to check for the bowel sounds. So now that I have examining the fundus, I will also be checking the lochia. I'll be checking its color, the amount, the odor, and the number of pads used. So as for episiotomy, I will be inspecting the incision. So I will be inspecting for any redness, ecchymosis, edema, discharge, and the approximation of the wound edges. And also when you inspect for incision, you always note if there is hematoma, and check the rectum as well for any hemorrhoids. So now I'm gonna check the bladder. Mom, are you voiding? Okay, great. So how often and how much? 30 ml per hour. Okay, that's great. How about your bowel movement? Have you had the bowel movement yet? Not yet? Okay. You may need a stool softener or a laxative for that. And I would also encourage to increase your fluid and juice intake along with the increasing intake of your fruits and vegetables. And ambulation may help too. It will help a lot. So now I'm gonna check your legs. I would like to make sure that you don't have DVT or thrombophlebitis. I will be checking for Homan signs. So do you have pain in this part in your calf? Okay, no. How about on this side? No pain in the calf? Okay, great. So I know, mom, you have concerns about your emotional status. So I would like to explain to you that those hormonal changes that are occurring and your emotions may really change from high to low quickly. So you may cry easily, but these changes are normal, okay? So mom, I would also like to give you information about what we call postural hypotension. So whenever you're sitting or getting out of bed, you have to move slowly, okay? Do not lock the bathroom or shower doors. And if you need any help, please use the call bell. We have one here at your bedside, and we have one in the shower as well. And as for caring for the newborn, always wash your hands before and after you provide care for the baby. And at birth, we only remove blood or meconium. We do not remove vernix, and we do not bathe the baby. So now, mom, let's go to breastfeeding. So breast milk contains exactly the nutrients a baby needs. It's easily digested and efficiently used by the baby's body, and it protects the baby against infection. It also helps the baby's development and your bonding, your mother-baby attachment. And I also encourage you not to drink alcohol or smoke tobacco or anything while you're breastfeeding. So now, mom, I'm gonna teach you on the correct positioning attachment for breastfeeding. So make sure your baby's head and body are in a straight line. Make sure that the baby is facing your breast and the baby's nose is opposite to the nipple. So hold your baby's body close to your body and support the body, not just the head and the neck and the shoulders. Touch your baby's lips with your nipple. Wait until your baby's mouth is open wide and then move her quickly on your breast, aiming the infant's lower lip well below the nipple. Now, after that, look for signs of good attachment. So, more of areola visible about the baby's mouth, mouth wide open, lower lip turned outwards, and baby's chin touching breast. Now, if you're having breast engorgement, express a small amount of breast milk before starting breastfeeding to soften the area so it is easier for the baby to attach. Okay? And now I would like to give you information on how to take care of her at home. So, keeping your baby warm is really important for her to remain healthy. And you have to dress her like this, dress the baby or wrap in a soft, dry, clean cloth. You also have to cover her head with a cap for the first few days, especially if the baby is really small. So do not put the baby on any cold or wet surface. Do not bathe the baby at birth. And do not swaddle wrap too tightly because swaddling makes them cold. And do not leave the baby in the direct sun or by the window. So as for the cord care, mom, again, always wash your hands before and after cord care. You don't have to put anything on the stump. You have to fold her diapers below that. You do not put bandage on it. You do not apply anything, any medicine or substances into the stump and avoid touching it unnecessarily. It will fall off on its own. And if you observe any pus or blood, let us know right away. Call your doctor right away. So at bedtime, use a firm mattress for her. Let her sleep on her back. Keep the baby away from people who smoke, and keep her away from a small baby with sickness, or keep her away from sick children and adults basically. So, mom, thank you for your time. Let me know if you need anything else or if you have any questions. I will now give you all the time to spend the time with your newborn. Congratulations again and have a great day.